right, party people, let's get it. So let's say I give you a dude in his 50s with a rash who comes to your office with normal vitals. He mentions that he missed his last appointment to the methadone clinic. I'll show you the rash right here. And now, which treatment would you choose? All right, first and foremost, let's go over how to approach this question. The mention of him missing a methadone clinic appointment implies that he has a history of IV drug abuse, most likely heroin. Methadone is a long-acting opioid receptor agonist used to prevent heroin relapse. So when a patient stops using heroin, they experience withdrawal symptoms such as piloerection, yawning, rhinorrhea, general discomfort, which in turn can lead them to relapse. Methadone stimulates the opioid receptors to prevent these withdrawal symptoms. The implication that he is an IV drug user, and IV drug use is associated with HIV and hepatitis C. Now, if we want to connect these dots, we would deduce that he has Kaposi sarcoma. This condition is classically seen in HIV-positive patients. While rare, it can still occur in non-immunocompromised patients, but let's just go with what is being presented. Kaposi sarcoma is caused by human herpes virus 8, also known as Kaposi sarcoma-associated herpes virus. When you're asked about pharmacotherapy in this context, your first thought might be an antiviral treatment, specifically HAART, highly active antiretroviral therapy, for underlying HIV and AIDS. But that was not listed, so now we have to go with the next best treatment. So for Kaposi sarcoma, the correct answer would be doxorubicin, which is an anti-neoplastic agent. Now, you're not expected to memorize first-line therapy for Kaposi sarcoma. It's basically being able to eliminate the other answers, knowing which ones would not ever apply. So we'll go through these. Doxorubicin, also known as adriamycin, is a chemotherapeutic agent. It's an intercalating agent that also generates free radicals. A side effect that you need to know is dilated cardiomyopathy. For dilated cardiomyopathy, we're going to take it back to cardiology. When I say dilated cardiomyopathy, I want you thinking of enlarged cardiac silhouette on imaging. You're going to have a lateral displacement of the apical impulse, S3, that's, bread and butter right there, and pulmonary edema. All right, let's run through the other options. Fluoroquinolones, such as ciprofloxacin, it's not relevant here. These are most commonly used for genitourinary infection, like pyelonephritis or prostatitis. Ciprofloxacin can also be part of the treatment for diverticulitis, usually combined with metronidazole. Fluoroquinolones inhibit bacterial DNA gyrase topoisomerase 2. This can cause tendinopathy, particularly Achilles tendonitis. For aminoglycosides, these inhibit the 30S ribosomal subunit. These can cause misreading of mRNA. Now, this is usually effective against gram-negative bacteria, but it has significant toxicities. So when I say aminoglycosides, I want you thinking N for nephrotoxicity and O for ototoxicity. For ototoxicity, we're talking about hearing loss and vertigo. Also, aminoglycosides can be used empirically with vancomycin for endocarditis, or with ampicillin for synergistic effects. Permethrin, this is a topical treatment for scabies. Scabies classically presents as an itchy rash in someone who's living in close quarters, for a homeless shelter, or soldiers in a barracks. It's resistant to antifungal treatment. Specifically, remember permethrin for these types of cases. And finally, a corticosteroid such as prednisone. It's not a terrible choice, but in terms of immunosuppressive or anti-inflammatory treatment, some students might just pick this because it seems like a reasonable answer. But it's not the preferred treatment for Kaposi sarcoma. And one final piece of information for bonus points. When we deal with bacillary angiomatosis caused by Bartonella henselae, this can mimic Kaposi sarcoma. Now, Bartonella typically causes cat scratch disease. Bacillary angiomatosis presents with vascular skin lesions in immunocompromised patients, often HIV positive. If you get a patient with Kaposi-like presentation, but all the choices are bacteria, look for Bartonella henselae. That basically steers you towards bacillary angiomatosis instead of Kaposi sarcoma. All right, that's it for this one. Go crush it.